This segment is sponsored by Holland Hospital. Whether you've suffered a heart attack or someone you love is living with heart disease, there is some good news when it comes to cardiovascular treatment. Whether it's medication, lifestyle modification, or the very latest in cardiac procedures, help is available at Holland Hospital, now recognized as one of America's 100 best hospitals for coronary intervention. Dr. Gregory Bernath joins us now to talk about cardiovascular treatment and intervention. February is the month when we do this, right?
Yes, that's correct. Yes.
How common is this, though? How many people have some sort of heart trouble?
28 million American adults have heart disease, and greater than 630,000 a year die from heart disease. It's the #1 killer of men and women.
When you say heart disease, what does that mean?
Well, it means coronary artery disease, congestive heart failure, rhythm issues, atrial fibrillation, flutter.
So really a very wide range.
Wide range of issues.
Yeah, and important to call attention to all of that, I'm sure. So when you talk about minimally invasive interventions, cardiovascular interventions, tell me what that means.
Well, from the cardiology standpoint, we have there's the ability to replace the aortic valves with a new valve being delivered with a catheter. The mitral valves can also be repaired by placing a clip on the valve. All that can be done for sort of outside of the body through catheters, without having to open up the chest and replacing the valve or repairing the valve by going inside the heart.
Which used to be the old standard, right? You used to have
correct.
to open it up and get in there.
That is right.
So with that kind of an advance in the way there are treatments, I suspect that an advance has followed in terms of outcomes, right?
Yes, yes. I think it started out, some of these procedures for these critically ill patients who would not make it through surgery in a traditional fashion, opening up their chest, stopping their heart, replacing the valves. So it started out with some of the older 80-year-olds and 90-year-olds, and it's worked out so well that now it's an option that's available for younger patients too.
Oh, that's good news. For people who might experience some sort of trouble at home, the advice is call 911. Never try to get yourself in the car, even if you think you'd make it, right?
That is correct. If you think you are having a heart attack, it's so important to call for help, because instead of driving yourself or having someone else drive you, if you call 911, the paramedics can arrive, they can analyze the situation, they can begin life-saving treatment. They also can notify the receiving hospital that there's a potential heart attack victim. We can mobilize a heart attack team. We'll be waiting for you. And unfortunately, less than 10% of the people call for help. And the problem is that a heart attack itself is rarely fatal, but cardiac arrest is about 95% fatal. And had a patient last year, his wife drove him, he was having chest pain, his wife drove him to the hospital, he had a cardiac arrest in the emergency room parking lot with all the kids in the back seat.
Oh my goodness.
Fortunately, he did survive.
Wow.
But it's just not the way to present to the hospital.
What does it mean to be accredited in cardiovascular excellence?
What that means is that it's the accreditation for cardiovascular excellence. It's a prestigious program that ensures the highest level of care for cardiac catheterization and for angioplasty. There are only 63 hospitals in the country that have that distinction, and Holland Hospital is one of them.
So what kind of services does Allan Hospital provide?
Well, we can do diagnostic cardiac catheterizations, we can do emergency balloon angioplasty and stenting, peripheral arterial disease, placement of pacemakers, defibrillators, and we can use temporary mechanical assisting devices for the failing heart.
I know a big part of the role of the institution is education, and so we cannot finish this segment without talking about signs of trouble, right? Yep. We're talking about call 911. What would a person be experiencing? And it's different for men and women, isn't it?
It is. Women have sometimes vague complaints. They may feel short of breath. They may have they may be perspiring. They may feel nausea. Not necessarily the typical chest discomfort. And people often say, well, I'm not having sharp chest pain, it can't be my heart. It's not the sharp pain I'm concerned about, it's the pressure, the weight on the chest, the radiation into the arm, the neck, the jaw. Something out of the ordinary, it just doesn't feel right. It's better to be wrong and show up in the emergency room than
to ignore it and have something worse happen.
Yes.
And for men, okay, so women different, but do men feel that piercing?
No, again, it's more like
a
chest pressure. And shortness of breath and fatigue and weakness. Sometimes it may be something they've had for weeks at a time, and sometimes it's just something that develops acutely.
All right. Well, Dr. Bernath will present a free community talk about cardiovascular treatment and intervention. There will actually be two events, February 13th at Holland Hospital and February 26th at Health Point in Grand Haven. There'll be free blood pressure checks before and after each presentation. You can sign up on the Holland Hospital website. We've put a link to it on our site. Just go to 13onyourside.com. You'll find it there. Doctor, good to have you here.
Well, thank you very much.
Thanks.